At its most basic level, a hernia is a defect or a hole in the abdominal wall. The most common hernia that we treat are inguinal or groin hernias. Those are in the groin area. The second most common would be umbilical hernias, which are right next to the navel. The third most common would be incisional hernias. And any place that you've had surgery on your belly where someone's made an incision, there's a weak point in your abdominal wall where hernias can develop.
If you had a previous surgery, the incision site becomes the culprit for weakness, where abdominal wall muscle or the tendon have a hole and bowel protrudes under the skin. It never goes break the skin, but you will feel a bulge. Sometimes it's painful, sometimes it's asymptomatic, but when you push it back in, it disappears, or laying down, it disappears. People generally are very scared of touching those bulges. Actually, I encourage them to, hey, test it. If it's going back in, that's probably a hernia. If it's a disappearing bulge. If it is not, and it's really hard, it could be a mass or an incarcerated hernia, which could be an emergency. There are certain risk factors for hernias. This could be job-related heavy lifting. There are certain weak points in the abdomen that can turn out to be hernia sites. But people who are doing heavy lifting, people smoking, people are heavier than normal body mass index, those are risk factors for hernias. 1/4 of the men have groin hernias in their lifetime. So there is 1 million groin hernia operations are done in a year in the United States. And whether to do it right now or whether to do it later, whether to do it at all, depends on patient's age, patient's functional capacity, patient's goals, whether he's a skier the season. So, I mean, provide all these information and patient make their own decision.
The mesh that we use today has changed significantly. It is still mostly non-absorbable, but there are absorbable options as well. But the mesh has evolved from a hard plastic type material to more of a cloth-like material that tends to work better with people's own anatomy. The beauty of hernia repairs is that it's not a cookie cutter approach to each patient. There's multiple different modalities to approach the hernia, whether that's minimally invasive or open. And then there's multiple ways to fix the hernia, whether it's sutures or using a mesh repair.
Between the mesh types, suture types, and type of techniques that you are using, I can probably combine hundreds of different types of fixing a hernia. You don't stay in bed 6 weeks, but the healing process takes 6 weeks. And according to studies, 80% of the tissue strength is completed by 6 weeks' time. So you can go back to skiing, playing tennis, or whatever the activities you have. During that time, you can walk, you can do mild activities, but not vigorous heavy lifting or any other physical activity that would demand a lot of muscle motion and intra-abdominal pressure. Patient's goals, symptoms, type of hernia, width of hernia, location of hernia, all plays a role in what type of surgery they will receive.